to 8 p.m. last night, we had more than 98,000 people come forward to get tested. Not only is that close, obviously, to 100,000 tests, but on a weekend, I just want to thank everybody for taking the effort and time and responsibility to do that. We had 145 cases of community transmission to 8 p.m. yesterday. 51 of these, unfortunately, were infectious in the community during that time. Can I stress again that it's really important for people not to leave home unless they absolutely have to, and in particular, do not mingle, do not have any exposure outside of your household with other households. We're still seeing that as a challenge, and especially as we've seen at a time of bereavement, we can't allow exceptions at this point. We don't want any setbacks, and we need to make sure that everybody appreciates how important it is not to mingle between households and to stay within your household. Can I also please ask that if you do need to work, you're recognised as an authorised worker, or you do need to work, that you please make sure that you adhere to all the COVID safety plans, whether it's wearing a mask, good hand hygiene, social distancing, all the other measures that are in place. Because every time any of us step foot outside our house, we have to assume that we have the virus, or anybody that we're remotely coming into contact with has the virus. Can I also please stress how important it is for everybody to get vaccinated? Please come forward and get vaccinated. Dr. Chant will talk about this as well, but especially in those southwestern Sydney suburbs and Western Sydney areas, we now have additional clinics. We've got pharmacists that are online, your GPs. It's really, really important for people to get vaccinated. Not only does the vaccine assist in keeping you out of hospital, but it also helps protect your loved ones, because we know that the vaccine helps in reducing how contagious people are. So obviously lockdown, restrictions and vaccines, a combination of those things, will help us live freely until the large proportion of our population is vaccinated. And that's the challenge for us, is to make sure that not only do we have the lockdowns and the restrictions in place at the appropriate time in the appropriate way, but also that more and more people are coming forward to get vaccinated. I welcome the revised health advice, which now says that all adults can get either vaccine. So please come forward and get vaccinated, even if it's the first dose. It's critical as part of our ongoing strategy, in addition to the restrictions, to make that happen. As I've said previously, this week, today and the next few days, on the back of health advice, but also in consultation with all of our officials, we'll be making decisions about what life looks like beyond July 31 in New South Wales. And so we hope to provide announcements or updates to the community in the next few days. And I say to the community, please be assured that our mission is to keep the community as safe as possible, but also to make sure we allow the community to live as freely as we can as well. And there's no doubt that some restrictions have better effect than others, and that is the advice we'll get from our health experts, as well as obviously in consultation with other officials. And I look forward to providing information on that in the next few days. Finally, before I hand over to Dr. Chant, I really want to thank the community of the Fairfield local government area. In the last few days, we've seen a reduction in the cases that council area has had. We also know that they're the least mobile in all of New South Wales. They've actually been doing the right thing, and now we know there's greater risk in the Canterbury-Bankstown area, in those suburbs. So we ask residents in the Canterbury-Bankstown area, in Liverpool, in the Cumberland local government area to be extra careful, and please abide by the rules. But again, a huge shout out to the people of the suburbs within the Fairfield local government area. We've seen an improvement there in the number of cases and the number of infections, and we need to see those results similarly in Canterbury-Bankstown. We don't want the spread to increase, quite the opposite. So if you live in those suburbs and areas that Dr. Chant will highlight, please make sure that you respect the health advice and respect the settings.